Hello, my name is Laszlo. I'm a registered nurse working in the emergency department of University Hospital Southampton, and I'm a devoted supporter of the COVID-0 campaign. During the early days of this pandemic, when new protocols had been introduced in our department, I remember I was waiting for my first shift in resuscitation room where we had to gear up head to toe in protective equipment. Before entering resus, I've made a selfie with my colleagues. You could hardly tell who's who on that picture, simply because most parts of our faces were covered. Later, when I have posted that picture on social media, I have attached a comment to it saying, most of the superheroes have something in common. They are wearing a mask. Whenever you decide to wash your hands regularly, to maintain social distancing, and to wear a mask in public places, you become a superhero. What is the common feature of superheroes anyway? If you look into the comic books and see the films, there's one thing which is common in all of them. They are saving lives. And you can save a life too, or many. A life as mine, because despite the fact that I'm young, healthy, and I have no pre-existing medical conditions, I nearly lost my life during this pandemic. The very fact that I'm here today, able to tell my story, is a miracle. It was April the 15th when I had to call the nurse in charge requesting to go into self-isolation, as my wife, who is also a nurse working in a different hospital, has developed some signs and symptoms which really worried me. At that point, I was asymptomatic. But it took just a couple of days for my general condition to decline rapidly. I've developed a fever, I had constant pain in my joints, and I have experienced tiredness. Still, I was so confident that because I'm young and healthy, I'm going to go through this very quickly. And I was telling myself and others, I'm going to be fine. I'm going to be all right. Yet, a few days later, shortness of breath and difficulties breathing started. And we have noticed that the oxygen level in my blood have dropped significantly. And that was the point where we have decided to call the ambulance. The ambulance took me into my own workplace, and passing through the doors of emergency department as a patient and not as a member of staff was probably the weirdest experience of my whole life. However, it was so comforting knowing that I'm in safe hands because my work family is looking after me. The very same day, I have been transferred to intensive care where a respiratory non-invasive treatment has been started. 2 days later, it was clear that this treatment is not helping me at all. I'm not improving. I'm not making any progress towards my healing. That was the point where the doctors have made a crucial decision to step to the next level. Using general anesthetic, I was put to deep sleep. I was intubated. I was connected to life-saving equipment. And also I was referred to a specialist treatment center in London. While we've been waiting for this transfer to happen, my condition has further declined up to a level where the nursing team had to call my wife and tell her that if she would like to have a priest for me, now would be the time. There was a huge question mark hanging in the air. Am I gonna make the journey to London alive? While I was transferred to London, the leading consultant called my wife from the ambulance, telling her that the chances of survival have dropped to 40%. And he explained to her, even if I'm gonna make it, I'm gonna spend at least 3 weeks or more on these life-supporting machines, several more weeks afterwards in intensive care, and who knows how long in rehabilitation. When I woke up later from this deep sleep, I've learned that hundreds, even thousands of people, many of them I don't know personally, have been supporting us in many creative ways here in UK and abroad as well. This included my work colleagues from ED, my family, my friends, neighbors, members of the church, And many of these people were praying for us as well. As a result, instead of spending 3 weeks or more on these life-supporting machines, I've been disconnected in just 7 days. 5 days later, I left intensive care unit in London, being transferred back to Southampton to a ward. And 9 days later, I have been transferred and discharged home. It's hard to talk without emotions about this difficult journey. But let me say how thankful I am for modern medical science, which created these incredible machines that played a crucial role in saving my life. How thankful I am for the medical staff, both in Southampton and London, including doctors, nurses, healthcare assistants, porters, receptionists, even members of the security team. And probably my story wouldn't tell the whole truth if I wouldn't say that I'm thankful to God as well, who went beyond and above science and human knowledge and made the impossible possible for me. I was so thankful to be alive, to have a second chance. I was enjoying even the smallest joys of life, such as the taste of Weetabix in my mouth. And I was making plans on my hospital bed, which now counting them, probably they are going to be enough for at least 3 lifetimes. So why COVID-0 is important for me? 2 words: hope and warning. Hope because I meet so many people nowadays who are afraid, not simply of getting sick, but because of the consequences of this whole pandemic, which includes the economic ones as well. And by playing our small role in prevention, we can potentially shorten the length and reduce the consequences of this pandemic. And warning because I meet also so many people nowadays who are denying the very existence of this virus, fabricating and creating conspiracy theories, while my experience says exactly the opposite. So wash your hands, keep the distance, and put on that mask. Be a superhero. Thank you for listening.